The GMA Health Alert for Glaucoma Awareness Month. The disease is often called the silent thief of sight. More than 4 million Americans have it, but roughly half don't even know they do. Our chief medical correspondent, Dr. Darien Sutton, is here with what you need to know to protect your vision. It is great to see you, Dr. Darien. So talk about why this is so serious.
Yeah, so just beginning with an understanding to get everyone on the same page. Glaucoma is a problem with the nerve, the optic nerve that supplies our vision. That is found at the back of the eye, and it's most often due to increased pressure. And you said something so important. More than 4 million people have it, but almost half of those who have it don't know. And the reason why is because when that pressure increases in our eye, just like blood pressure, we don't feel it until that leads to irreversible changes in our vision. And as you can see in the healthy eye, that's without that pressure. And the key point in that picture with glaucoma is that pressure is exerted to the back of the eye. Those are where our important nerves are. That is what helps us to supply vision. You want to make sure to catch and identify this diagnosis before your vision starts to change.
Yeah, why is this so hard to detect? What are some signs or things people really need to be on the lookout for? And also, does this only affect people of a certain age? I think that's what a lot of people think.
That's a great question. The answer about age is no. Although age is a risk factor, those over 60 are increased risk of this. There are some who don't realize they have an increased risk. For example, those who have a history of Hispanic or Asian ancestry, Black Americans. But on the screen, I want to show you what it looks like. This is a severe form of it. You can see the normal vision. You can see the beautiful landscape. And on the glaucoma side, you see what's called tunnel vision. That's when your peripherals, the sides of your vision, get difficult. And as we were discussing during the break, it doesn't always look like this. It's really about catching those early signs. Difficulty driving at night, sometimes not seeing cyclists, sometimes not even seeing pedestrians. And that's why it can be really difficult. Also, depth perception. Stairs and curves become really difficult. When I treat patients in the emergency room who have multiple falls, the question about eye exams begins, and that's often where I realize many people don't realize that they have this diagnosis.
So there's kind of like a shadow over anything that they're seeing if they have glaucoma.
Yeah.
So once you've detected it, you've gone to the doctor, you've gotten the diagnosis, what does the treatment look like?
Well, the treatment can be relatively simple for those who have early symptoms. It can be as simple as drops. Sometimes it can include lasers, and at the severe forms, it can include surgery. But what's really important to understand is that you want to detect a difference in the trend, and that's why it's so important to understand when you should get your eyes tested. Up to 40% of people don't have up-to-date eye testing. It's important to note at least once before the age of 40, and then after the age of 40, depending on your risk. If you have diabetes, if you use certain medications like steroids, or if you have a family history, you probably need to get your eyes checked more often. This doesn't just include a visual acuity test. This includes checking the pressure of your eye, sometimes dilating your eye and looking at the back of it. That's what we call a comprehensive exam, because there's no single test. It's about detecting changes in the trend and stopping this problem early.
Yeah, stop it early, because if you fall and you're over 60, things get much more serious as well. Dr. Darien Sutton, thanks so much for being with us. Really helpful breakdown.